Hope Walks. Early clubfoot treatment transforms children's lives. In many low and middle-income countries, children born with physical disabilities face lifelong barriers that limit their ability to learn, play, and participate in their communities. One such condition is clubfoot, a congenital deformity that twists a baby's feet downward and inward. While it is routinely corrected in wealthier nations, lack of access to treatment in poorer regions often leaves children disabled for life. In research funded by the University of Notre Dame, Bruce Wydick, Gianna Camacho, and Patrizio Piraino reveal how early, affordable treatment for clubfoot can transform not only a child's mobility, but nearly every aspect of their well-being. The team's research examined the long-term effects of treating congenital clubfoot on human flourishing, a measure that includes physical, psychological, social, faith, and educational outcomes. The study focused on Ethiopia, where many families live far from medical services, and disabilities often go untreated. Working with Hope Walks, an organization that provides clubfoot care in Latin America, Africa, and Asia, the researchers gathered data from 564 Ethiopian children, both treated and untreated, along with their nearest age siblings. The team found that children whose clubfoot went untreated showed significant disadvantages in almost every area of life. On average, their mobility, mental health, social inclusion, education, and participation in a faith community were all far lower than those of their siblings. In terms of human flourishing, most of these children lie in the bottom 10th percentile. But when children received early treatment, much of this loss was reversed. Those who began treatment before 6 months of age regained about 70 to 80% of their lost well-being. The improvements extended well beyond physical ability. Early clubfoot treatment restored the vast majority of their lost social inclusion, mental health, spiritual faith, and dramatically improved educational outcomes. Children who received early treatment often perform better in school than their siblings. The transformative impacts of the treatment stand out especially when compared with the treatment's low cost. Hope Walks uses the Ponseti method, which involves gently manipulating the baby's feet into the correct position using a series of casts and braces. The entire course of care typically costs around $500 per child, a modest sum compared with most other health interventions. Despite the affordability of the Ponseti method, many children still miss out. The study found that the main obstacles in Ethiopia were a lack of awareness, distance from clinics, and parents' limited time and finances. All of these issues can be addressed with increased resources. The practical implications from the research are clear. Expanding access to early clubfoot treatment could have enormous ripple effects across children's lives. The researchers note that few health interventions in low-income countries achieve such large, broad, and lasting benefits in social inclusion, mental health, education, and even spiritual formation.